Assalamualaikum to all participants and audience. I am Siti Normiyah binti Hussein from Faculty of Pharmacy and Health Sciences, University Kuala Lumpur, Royal College of Medicine, Perak. I am going to present my study on knowledge, attitude and perception of polycystic ovary syndrome PCOS among young students in higher educational institutions, Perak. Here are my table of contents that I will be going to discuss today. It's cover research background, methodology, result and discussion, as well as the conclusion. As I start with research background, what is PCOS? Polycystic ovary syndrome is a genetic, hormonal, metabolic, and reproductive disorder that affects most of women. According to Women's Health Government 2019, between 5% and 10% of women between range of ages of 15 to 44 years old or during the years they can have children, they have PCOS. Most women which in their 20s and 30s can detect they have PCOS, where at that time they have problems getting children. They have also have problem with getting pregnant, and when they see their doctors, they only detect they have PCOS. However, PCOS can happen at any age, especially after puberty. PCOS is one of no transmissible disorder that only affect the women, which needs attention. In order to diagnose probable case of PCOS, presence of oligomenorrhea, irregular cycles, hirsutism among young girls 2 years post-menarche can be a good screening indicator. This is explained by Najaya and Rupadevi in 2018 study. It is high prevalence of PCOS and a specific phenotype of PCOS among the female Malaysian employees. This is also has been shown in Deshti et al. Study in 2018. And it's about 72.5% female students of age range between 18 to 26 revealed that they were not aware about this syndrome. This is proven in Haq et al. Study in 2017. What is the problem? The prevalence of PCOS is increasing rapidly worldwide, but the females don't have adequate knowledge about this syndrome. Many females are actually unconcerned about PCOS, even though most of them have experienced it in signs and symptoms. This is mentioned in Haq et al. In 2017. So, the objective of this study is to assess the level of knowledge of young generations, especially in higher educational institutions in Perak regarding PCOS. The second objective is to evaluate the level of attitude as well as to determine the perception of young generations in higher educational institutions, especially in Perak regarding PCOS. The young generation of higher educational institutions, whether in public or private universities, have low level of knowledge. This is the hypothesis before we start our study. So they have low level of knowledge on the PCOS. The attitude and perception on PCOS among young students of higher educational institution in Perak is also varying based on their field of study. The significance of this study can be used to justify the extent of knowledge, attitude, and perception of young generation from high educational institutions regarding PCOS. We can see PCOS, how it developed within the young students nowadays. Findings provide information regarding level of knowledge of respondents regarding the topic. And this is also can give a significant evaluation of respondents, which will tell us whether they're concerned about the causes, diagnosis, and complication of the disease. The study is also to determine what is PCOS in their perspective view, especially in young students, whether it can be treated or is it just affected the married people only. We come to our methodology. We use the mixed methodology approach, which is structured survey questionnaire and also online Google form to get the response. And the study population involved from three public universities and also young students from 3 private universities as well as 1 from public higher institution. And the sampling is convenient sampling technique we use to determine the sample size using Rosoft online sample size calculator with a confidence level of 95% and margin of error 5%. So the recommended sample size from the calculation of the study is about 267 respondents. However, due to the pandemic COVID-19, which limited our resources of respondents, so we only managed to get the total number of 219 respondents, which is already sufficient for the data validation. The study instruments we are using, the questionnaire consists of 4 sections, which is section A, respondents demographic data, section B consists of knowledge respondents regarding PCOS, and the section C consists of attitude of respondents regarding PCOS, and finally the section D consists of perception respondents regarding PCOS. A pilot study has been conducted among 27 young students of higher educational institutions to validate our questionnaire. And from the study, the result that we gain from the study, we include the male and female as well, which consists of 56 of male respondents and 163 of female respondents. And we have about 13 questions under knowledge, section of knowledge of PCOS, and most of them, out of 13 questions regarding knowledge on PCOS, majority of the subjects showed 85% positive response. This means there is high knowledge on PCOS among young students regardless of their background. As you can see, the sample of the result. And from the attitude sections questions, according to clinical evaluation, most of respondents answered negative to all clinical parameters. About 30% of them showed negative response, which means there is still lack of awareness in PCOS among the young students despite the number of cases increased. That's why in terms of attitude, we still have lack of awareness towards the PCOS. And under the perception sections, about 80% of respondents showed positive response or high level of perception, which means they have good perceptions toward PCOS. This is include the background, their background, and also the knowledge about the PCOS amongst the young students. Finally, we can conclude that even this is the short period of study, we able to determine the adequate knowledge regarding PCOS among young students in private and public institutions in Perak. And they also show good attitude regarding PCOS as well as good perception regarding PCOS in this study from the young students in public and private institutions in Perak. However, there are limitations in the studies where we recommend to widen the variety group of respondents may be needed, especially from adult or working people or professional populations, and not only limited to young age or young students of higher education institutions. Future researchers also can plan to have a variety demographic of population respondents, such as people in rural area versus people in urban area. Also, the research may also focus only on women group of population, which we need higher awareness amongst the population. It is good to know the gap level of the knowledge between different of populations. It's not only in Perak, especially, and also in Malaysia, but in other countries as well. These are my reference for my study, and with that, I thank you.